Hello fellow dog lovers and welcome to Bella's Dogumentary series. This is a new chapter in her life living with B Cell Lymphoma. It is a fatal disease unfortunately, but she is a member of our family and we want to do whatever we can to give her the best life. This video will speak about her diagnosis, her options and how we decided on what our family believe is the best quality of life for her. Hopefully I'll be in a position to make future videos with updates on how she's progressing. I've had Bella since she was a pup. Both of her parents are pedigree, so it goes to show that cancer does not discriminate. She's turning 7 next month and has led a very spoiled life in our family so far. So towards the end of 2022, I was walking Bella along the beach when she let out a yelp and started limping. It turned out that she had ruptured her ACL. So she was operated on in early November of 2022 and she had to have regular checkups with a vet, and part of that included checking the lymph nodes. One visit she was all good, and by the next visit, about 1 month later, there it was, B Cell Lymphoma. In a way, her ACL injury was a blessing in disguise because it meant that the cancer was picked up in its early stages. So I was referred to a specialist to discuss what options were available to Bella. I was told that if we did no treatment at all, we may get 2 to 3 months at best. The second option was taking a steroid, which was low cost, but wouldn't prolong her life expectancy very much further than taking no action at all. Then the only other option I was given was chemotherapy. The price I was quoted was between $12,000 to $20,000 depending on her reactions to the drugs. I was told she would have to attend the vet 1 day per week for 12 weeks. The side effects are awful: vomiting, diarrhea, low energy and a greater risk of infection. Plus, we humans have to take precautions when disposing of their poo and being careful when she wants to lick me because of the drugs she's taking. So now, I wanted to have Bella to have the best quality of life. If I could only have her for 6 months with a 90% quality of life compared to maybe 12 to 18 months having chemo with a possible 40 to 50% quality of life, then my choice was clear. I want it to be 90%. Other dog owners may decide to extract the longest amount of time possible, but for me, quality trumps quantity. So this is where the next blessing came into play. I do some share investing and I'm a shareholder of a company called PharmAust. They are currently running a trial for dogs suffering from B Cell Lymphoma. So when I became a shareholder a couple of years ago, I never thought that my dog would have cause to be enrolled in the trial. The closest trial centre for me was in Albury, New South Wales, which is about a 4-hour drive from where I live. So I drove Bella to see Dr. Renee Pigden, who kindly fitted Bella into her busy schedule. She was accepted into the trial that day, and as of today, we are up to day 48. The only side effects I've noticed so far is some weight loss. Even then, her weight loss may be as a result of my changing her diet. I've been preparing a homemade casserole which is higher in protein and lower in carbohydrates. I've included ingredients such as turmeric and ginger, which are cancer-fighting foods. She still loves her food and will eat anything that's put in front of her, so that hasn't changed at all. That includes her medication, which consists of 2 tablets of the trial drug called Monipantal. She must realise that she has to have them every day because she eats them straight out of my hand now. She also still loves going for walks too. So all in all, life for her goes on as normal. The Monipantal canine trial will not cure her cancer, but then again, neither will chemotherapy. Monipantal slows the growth of the tumours, and on day 28 of her trial, she underwent another ultrasound and blood tests, and they came back as having what's called stable disease. I won't go into the nitty-gritty about how they calculated the stable disease, but there are no new lesions and the current tumours are stable. It's exactly what I'm after. I just want to put in a disclaimer here. This is my first video creation, so I apologise for the quality or lack thereof of the video. I just wanted to put this video up to start off her story for any other dog owners that are in the same position. If you have any questions, please put them in the comments section and I'll answer them if I can. So just a couple of thank yous before I go. I just want to thank Dr. Erin Allenson at the Peninsula Vet Care for her early diagnosis of Bella's B Cell Lymphoma. Also thank you to Dr. Kim Agnew, who is the lead investigator in the trial for PharmAust. I also want to thank everyone at PharmAust for accepting Bella into the trial. But most of all, a huge thank you goes out to Dr. Renee Pigden, who has looked after Bella throughout her trial. So until next time, Bella says goodbye.